House Democrats have introduced a bill to help workers keep their job-based health insurance coverage during the COVID pandemic. It was introduced by the House Committee on Education and Labor Chairman Scott, along with Congressman Horsford and Congresswoman Dingell. It's called the Worker Health Coverage Protection Act. It would provide federal assistance to cover the full cost of COBRA premiums for workers that either lost their job or had a reduction in hours. Now remember, COBRA is that continuation of coverage. People are able to pay the full cost of their insurance premium to keep that insurance that they would have had they still been working. COBRA premiums are known to be quite expensive. This legislation tackles that head on and suggests that the federal government would pay that COBRA premium so someone could keep that job-based health insurance coverage. It also takes into account some provisions for furloughed workers. It would cover the full cost of health insurance premiums owed by a worker who was furloughed as well. The goal of both of these provisions, for both the COBRA premium and the full premium for a furloughed worker, would be to help maintain coverage and provider networks, preserve deductible periods, and help prevent gaps in coverage for all of those workers that are suffering because of the coronavirus pandemic. It was introduced in mid-April, and like we said, this is just in committee right now. Still has a long way to go if this were to become law. But you might be saying this sounds kind of familiar, this language of this bill. And it is. It's because this legislation was modeled after a similar program enacted back in 2009, authorized by the ARRA, the American Recovery and Reinvestment Act. It helped working families preserve their existing health insurance coverage at that time. So we've seen this work before. Here's a couple quotes coming out of that Education and Labor Committee. First, Congressman Scott, the chairman of the committee, says the Worker Health Coverage Protection Act would provide immediate relief to workers and their families by making sure they do not lose their health insurance in the middle of a pandemic. Congresswoman Dingell adds, during a public health crisis such as this, access to quality and affordable health care is not only essential, it's critical. You can read the text of the bill. The committee also put out a fact sheet that helps explain it. We link to both of those in the description below.